Good evening, guys. This is Dr. Bass. We're going to be covering junctional rhythms and SVT rhythms in our EKG lecture today. The first thing we're going to talk about is the actual anatomy, physiology, and the function of the AV junction. So the first thing is some terminology. When we're talking about the AV junction, we're talking about two things. We're talking about the AV node and we're talking about the bundle of His. So if you remember when you did your initial lecture in EKGs, and of course all of your physiology that you've had cardiac-wise in the program, the AV bundle or the bundle of His is the only cellular connection between the atria and the ventricles. So the bundle of His, together with the AV node, makes up the AV junctional tissue. That tissue has an intrinsic heart rate of between 40 to 60 beats per minute. And what that means, obviously, is if this particular node, if something happened to the SA node and this node has to pace the heart, it would pace it at a rate of 40 to 60 per minute. That's the intrinsic rate of the AV junction. If the SA node fails, the AV junctional tissue can control the heart rate, as we said. The other really important function of the AV node and the bundle of His, or the AV junction, is it actually slows down that cardiac impulse, that action potential that's coming from the SA node. It slows it down and holds it for few tenths of a second in order for atrial contraction to occur. So you've got the electrical impulse that travels throughout the atria that depolarizes the atria. And once they're depolarized electrically, you're going to have mechanical function, which is contraction of the atria. In order for that atrial contraction to be effective, it needs to take place, obviously, before the ventricles contract. So the function of the AV junction is to slow down the cardiac impulse.